Good afternoon. Welcome to the special Superintendent's Webcast, July 7th, 2020. We have another full agenda for you. Before we get started, I wanted to apologize. I sent several emails to you today with this calendar invite and the link on how to get on this webcast, and thinking I was doing a favor to our staff, I sent the wrong link. I sent the Microsoft Teams link. You should have gotten the link to the KD Media portal. This is what happens when somebody that has the best of intentions but doesn't know what they are doing does something. So I apologize for that. We have staff today covering the state board meeting where they're interviewing the three finalists for the commissioner's position. We were also covering the interim joint committee, and so sometimes no good deed goes unpunished. So I'm glad we got that corrected. Superintendent Russ, thank you for pointing out to me that I sent the wrong link out, or don't know that I would have noticed it. So I think everybody, you should be on the media portal now and watching this. So we want to thank you for being with us, and some of you may be watching later on as well. Of course, we have a communications update today and a much anticipated update from the Kentucky High School Athletic Association. Commissioner Tackett is with us. And then we have some new guidance that released this week on reopening schools regarding workplace health and safety. And then, of course, our weekly favorite, which is the update and continued discussion with Dr. White regarding the public health issues during this public health pandemic that we are in. And I think we also may have Dr. Meserly as well with us. And then, of course, a question and answer session to I'm sure we'll fill up the entire 2 hours. So as always, you can submit your question with the Go Soapbox link that was emailed to you, and we will take those questions. Tony, I'll turn it over to you for a communications update.
Actually, there's a surprise slide in there for you there, Commissioner.
Oh, yes. Thank you. We wanted to give a shout out to our new superintendents. And I want to give a caveat. If we missed you and you're a new superintendent, we apologize. We're coordinating with the KASA and other groups to make sure we have the complete list. We know sometimes these change, though, could change it overnight due to board action. So the following, I'll read these. Tom Gambrell, Bell County. Matthew Turner, Boone County. Robert Tuck, Butler County. Christopher Benzel, Christian County. Brian Alexander, Edmonson County. Patrice Chambers, Fulton County. Kevin Stoll, Garrett County. Damian Johnson, Jenkins Independent. Mark Martin, Meade County. Josh Hurt, Metcalfe County. Tony Watts, Newport Independent. David Trimble, Pikeville Independent. Carrie Ballinger, Rockcastle County. Leon Smith, Russellville Independent. Sally Sugg, Shelby County, is that correct? Mark Thomas, Todd County.
Yep.
All right. Is
that it? And if we missed anybody, just make sure you let us know so we can add you to our next week's shout outs.
Yes, if we got anything wrong and you're in the honeymoon phase, welcome. It will be short-lived, I'm sure, as you talk to your colleagues from around the state. But this is probably one of the most rewarding professions, as you all know, you can be in. So welcome, and welcome to the superintendency, and I look forward to working with you.
All right, I will go ahead and get started with the superintendent's, the communications update. We have a couple of things to update you on today. If I can get the slides to work, there we go. Just wanted to go ahead, as we do each week, to give you an overview of the guidance issued for reopening schools. Again, just to remind you, we've been issuing guidance since May 15th. About every week or so, we are giving updates on everything from initial guidance to student and staff wellness, USDA meal preparation, people transportation, and then last week was facilities and logistics. This week was workplace health and safety, and we'll get to talking about that a little bit later in the webcast. And as you can see, to come are some of these other areas in teaching and learning stage 2, exceptional learners, and performance-based instruction. So we have good news on our COVID-19 need sensing surveys. All of those have now closed. We conducted a set of need sensing surveys to gain a better understanding of the needs of teachers, schools, districts, and families resulting from COVID-19. And the findings are going to be used to better understand how we will support education stakeholders across the state. We will share the results of these surveys at next week's webcast, which is July 14th. So make sure you join us for those. We will get those out to you either before the 14th or on the 14th so that you will be able to have those to share with your staff. The total respondents, we had 146 superintendents, over 7,600 teachers, 59,565 families slash caregivers, 222 families that responded with Spanish, 551 respondents, and just over 9,100 classified staff. And that survey closed yesterday. So we're very fortunate to have all of those respondents, and we're very appreciative to your help to get the word out to take those surveys. Also wanted to remind you about our deadline for the Kelly Award. Last week we had 7 nominations. This week we have 12, and you have one more week to submit a nomination for the Kelly Award for Business and Award Partnership. Just want to give you an opportunity to give a shout out to a business that is in your community that sustains a strategic partnership between your school or the district in your school or school in your district. And this is a great way to recognize them. And you can click on the link in your PowerPoint or email me for more information. Our commissioner search, as you can see, I am here at the Seelbach Hotel today. They conducted their first round or first part of the interview process with the 3 finalists last night. Today they are doing day 2 of the interviews. And so that is kind of where we are. These are your 3 finalists. We have Dr. Jason Glass. He is from Jeffco Public Schools just outside of Denver. We have Dr. Julian Heilig. He's Dean of Education at the University of Kentucky. And we have Dr. Felicia Smith. She's an assistant superintendent in Jefferson County. And all 3 of those individuals are interviewing one-on-one with the Board of Education today. And then we have, this is the survey that you all asked us to send out last week during the webcast. And we are pleased to announce that we have those results already. And we received 130 responses to these questions. We asked 5 questions. And the first question was, we were asked to indicate the first day of classes. And 43 districts indicated that they will open on August 26th. August 26th, 43 districts. And then August 12th and August 24th each have 18 districts opening. And then with that, I'm going to toss this over to Karen Dodd, and she's going to kind of walk you through the bar graphs that are going to come up on the next slide to give you some percentages. Karen?
Thanks, Tony. Good afternoon, everyone. You can go to the next slide, Tony. That's the one you just read from. That was the first question about when will your school reopen. On the next slide, the next question was, which alternative learning experiences are you planning? There we go. Are you planning? And so the number 1 response came up hybrid, with 62% of responses being in that category. And then as you can see, it's pretty well tied between scheduled rotations, synchronous opt-in, and fully online. Tony, you can go to the next slide. The next question was similar. Which alternative learning experience will you implement during the first week of school? And that was pretty much the same as the first one. Again, it still came out with hybrid being the top, but only 54% as opposed to the 62. And then again, very evenly spread between scheduled rotations, synchronous opt-in, and fully online. You can go to the next slide, Tony. Then we asked, even with staff scheduling arrangements to cover lunch duty, how easy or difficult will it be to provide duty-free lunch for certified staff? And of course, the majority of you said that this would be very difficult. We had 58% in that category, 35% saying somewhat difficult, only 5% saying somewhat easy, and less than 1% very easy. Going on to the next slide, Tony. How important is it for you to know if districts must provide 170 days of instruction as required by statute during the 2021 school year? Here again, we had about half, 51% of you said that it is extremely important, 30% somewhat important, and 20% not at all important. And those were all the questions that we had on that survey. Tony?
All right, and then just a quick announcement. I know that a lot of you have been asking about our 2021 Kentucky Teacher of the Year Teacher Achievement Award winners. We are excited to announce that we should have some exciting news on that next week. Obviously, the COVID situation has extended that. Normally this is something that we would announce earlier in the year, but we were fortunate enough to continue the process and hope to have that, as well as the next Commissioner Student Advisory Council for the 2021. Both of those things should come out next week. So we're very excited on those two things. And I know several of you have been asking about that, so I wanted to give you a quick update on that. And then with that, is Julian Tackett on. Julian?
Good afternoon.
Good afternoon. I will hand it over to you, sir.
Thank you. I watched the meeting from last week. I apologize, I had a conflict, could not make it, but I know the question, and I don't know if Dr. White's on here yet or not, but the question came up about masks quite a bit. And one of the things that Kevin reiterated, and we continue to reiterate, is we've been told that a statewide answer is not the best idea, that you need to be able to look to your local health department for guidance. It needs to factor into your existing policy, et cetera. I do want to remind you, and we sent a lot of references to Dr. White and to Kevin this week, and I can provide those to anybody that wants them, but almost every group that is regulating athletics makes an exception for the mask in the immediate moment that a kid is competing. It's not that it's prohibited. As a matter of fact, in some sports where a mask would normally not be permitted, it is now permitted during the COVID-19 outbreak. So it's one of those things that needs to factor into your basic policies. I know I watched the answer that Kevin gave last week, and it was spot on. You can be consistent and not be identical. And that may be where this lies in terms of all the mask guidance. I listened today to the Interim Joint Committee on Education and some of their statements about masks. We are not going to get caught up in the issue that is the politics of this. We're just going to stay on the safety side of it. Everyone should be in a mask, but those that are not involved directly in competition at that moment, without question, should be in a mask. And I think we'll probably put it out as a safety expectation once we get a little closer to regular practice. Now, bringing that up, let me tail into the next thing, because I know you all have a lot more important issues to talk about today than sports. This week, our Board of Control will meet on Friday, and there's several superintendents on the board, and there's principals, and there's ADs. There's 18 people from throughout the state. As a matter of fact, we retained for an additional 6 months an additional principal who had been on the board and 2 superintendents. We really feel like we need as much administrative input as we can get. They're going to meet Friday, and we're going to talk about the next stages of any activity. And as I've shared with this group before, at some point the activity has to focus on this fall and not all 18 activities at once. It was very important a month ago, very important to the psychological well-being of the kids to get them back on campuses where possible and where safe, and dealing with the coaches who many of them confide in like no one else. That's been very, very helpful. But at some point, it needs to back off and be the fall sports that we're going to have. As I shared with the Education Committee this morning, we are rolling toward having fall sports. Now, what that looks like, could change every day. I think, like every one of you, we're all concerned about what we're going to see toward the end of July after this latest holiday weekend. So, we're kind of sitting on eggs, but sitting on go. We're trying to balance the tightrope between giving the kids the activity that they want and need, and also realizing that, like it or not, it's the best dropout prevention program our schools have. It's the best get you involved program our schools have outside of curriculum. So we're all balancing here, and we're all trying to walk that tightrope. And I know that I'm going to talk to the board about a couple of things, and I want to share them with you all because I've got a couple of issues that I want to be sure I update you on. We're going to talk to the board potentially about what we do with a couple of our rules. Bylaw 9 is something that gets a lot of play around the start of the school year. And basically, it's a rule that says you can't play on an outside team if you've already played for a school after being in 9th grade. And our schools put this rule in years ago. We have proposed trying to discuss taking it out, and our schools just aren't interested. Every time we brought it up, our principals and athletic directors, even our board, are not in favor because they want to keep the outside influences away, especially ones that may not have education athletics as their number one priority. So we're going to be talking about that. We already have allowances where kids can go to recruiting events. For those that don't know, as of right now, through the end of August, the NCAA has shut down in-person recruiting. So people can't really tell you they're missing NCAA recruiting events. They need to go to this event because it's going to get them exposed. In reality, that's not true. There's some salesmen trying to sell you on that. They're also trying to sell parents a packet of material. They'll make a video of your kid for X number of dollars and send it around to people. Whether it ever gets opened or not, no one knows. But it's just we will have to talk about that issue. We're going to talk about our Bylaw 5. Bylaw 5 has two parts to it. That's the academic rule for those that weren't involved in athletics early in your career. And there's two pieces to the academic rule. The first one requires you to be on schedule to graduate according to your class's required number of credits. It requires you to be on schedule, and it's a mathematical formula on the first day of school. We have heard from a number of schools that because they were either having to ramp up NTI or having to revise things or perhaps shutting down early, they're just not sure if the first day of school credit check is a valid measure for what a kid's done during their high school career during this time. So we're going to talk to our board members about potentially suspending that. If any of you have kept up with Ohio, you know that they have suspended that for 1 year. That may be our best course, but we need to lean on our school people to tell us. So if you have thoughts or influences, you definitely might want to get a hold of one of the board members or me. I'll be glad to share whatever you send. I'll also tell you that one of the things that was lost this summer that has been a tremendous source of help in keeping kids that may have fallen behind from getting further behind is those summer workouts, those early times when our coaches have been able to get together, maybe have their team together. And I'm not talking about 2020, I'm talking about most other years. They've been able to do remedial work or prescribe remedial work, even get people involved in correspondence work if necessary. And that's somewhat missing this year in some districts. We've heard that consistently. So we're going to talk about that bylaw and see what our best response would be. Thirdly, we have a rule that requires you to be enrolled in a school to play. And thus far, you are required to look on your computer and Infinite Campus and see, is that student A1 in your school? Well, we know from talking to several districts that there's people that have kind of been waiting on some additional instruction, and in a lack of that, they've gone ahead and plowed their own course, and they have created A5 programs, for example, that might be your kids. That might be a way people code different types of students. I know KDE will have formal guidance from David Couch and all the people that work in that area. I know they'll give you formal guidance as you get closer. But what we don't want to do is have athletics be the inhibitor in you trying something special. So we're going to discuss maybe for this year, we let the school districts tell us if that student's enrolled. Now, there's a catch to it. One of the things that we use the A1 numbers for is the classification of sports. Now, we at the association only classify track, cross country, and football, but those numbers are also provided to the people that run the All-A Classic and other places, because those are the official numbers about a school. Those are the numbers money's based on. So in general, those are the most accurate. We're going to have to find a way, figure a way, work out a way that we can get those numbers of non-A1 students, but they're in your district or in your school for the purpose of those enrollment counts. I know nobody on this call would ever do this, but in the days before we used automated enrollment, there were people who might fudge their numbers to if they were close on a border with a class in football or a class in track. So we just got to keep the integrity of everything in line, and we know that's going to be a requirement. Last thing I'll talk about is obviously getting talk is the resumption of sports and what it's going to look like. And as of July 7th, it's still not real clear. We're watching for data from states that started early. We know what's going on in Iowa, where they played baseball and softball this summer. That's their normal season. We have seen that happen. And they've probably experienced what we would call our likely short-term normal. And that is that they have had people play and then all of a sudden have shut down a couple of weeks and come back and play and shut down a couple of weeks. And that's actually the way the system's supposed to work. We had two districts tell me yesterday that they have shut down their workouts temporarily because of a community outbreak. They didn't say if it was in the program, but they did say that, they've got a community problem, so they're shutting it down. And that's what the public health guidance wanted everyone to do, was have a procedure in place that you worked out where you're going to quarantine, how are you going to quarantine, how are you going to shut down. We'll then work out when we get into really closer to play, how does that affect rankings and standings and things like that, and perhaps make a statewide answer. So we're all kind of slogging through this together. Our next segment would actually start next Monday, and our board doesn't meet till Friday. And that's unfortunate timing, but you know what? I think if we come out and said you could or couldn't do something, our people would adapt on the fly. The great thing our school people have proven all spring and summer long is how adaptable you are. And so we will hopefully have a decision Friday on at least what we're going to do for the next couple of weeks. If I had my druthers, we would set something up for the next couple of weeks, and then we would put together a little comprehensive survey we could get out to our schools. And we need to find out within our schools who feels how. That's risky because sometimes our superintendents give us one opinion, and our principals give us another, and our athletic directors give us another, and our coaches give us another. And I know your first reaction is probably, well, I signed the checks, but you'd be surprised what people say when they're asked their opinion about sports. The other thing I'll tell you is any survey we do, if we do it, the results will be public right down to the respondent, because we're subject to open records and we really don't have any choice. So that may be a reason for communication within the building if that's done. We think that the experimental time periods and putting it in your hands has worked very well. We have started talking and we have conversations going with both the governor's office and introductory conversations with everybody else that'll be involved about what games might look like. But the last piece we'll have to talk about is who plays in the fall. Right now, we are moving along with our regular 6 sports playing in the fall, period. But you don't have to read very far on your social media feed or Google or whatever to know that everybody's watching what's happened with these early schools that are practicing football. Whether or not the transmission is actually organizations who are battling their own turf. The best thing we know is our state will need to make decisions for our state. We may come to the point where out-of-state travel is highly restricted. We may come to the point where we say it's up to you. We may come to the point where we say your board has to reauthorize any out-of-state travel. Those of you that have known me a long time and worked with me know that I'm a fairly huge advocate of local control where it's possible. And there's some decisions people are going to have to make. And we also know to the north of us, Illinois and Indiana and Ohio are rolling on with fall sports. Now that could all change next week. So we have to also set up something as we look at all these others and try to get good guidance. It sets up something where we can easily push a pause button, press a play button, push a pause button, press a play button. And for those of you that aren't old enough to remember a cassette tape 8-track, I had to do that. So just wanted to kind of give you an update. Kevin asked me if I would, and Tony asked me if I would just kind of answer a couple of questions from the past. I know there's always a ton of sports questions. I can tell you that the Interim Joint Education Committee today was extremely, it's beyond supportive. It actually was backing very much having fall sports because of the vital role they play in getting kids to school and getting kids involved. The other thing that I did not mention that I will say is whatever method you choose to start school, because we've been asked this 100 times, as long as you all verify that they are enrolled in that school, not a choice of schools within your district, but that school that they're going to represent, then that school they're going to be able to play for. We've always had students taking virtual or remote classes and still playing sports. That's really been your all's call, as long as they were A1 into your school. And as I mentioned earlier, we'll look at expansion potentially of that A1 definition when we get a feel from our administrators on the board of how things are going. So Kevin, it's a long summary, or Tony, I don't know, I guess Tony's moderating. If there's anything else you all need or had queued up, feel free.
Perfect, Julian. Commissioner, exactly, I think what superintendents were looking for. We have some questions, Tony, coming in through Soapbox, if you have a few more minutes.
Oh, yes, sir.
Yep.
Tony,
So we'll go ahead and get the question. So for Julian and Dr. White, recommendations on participation and extracurricular / sports involvement for students who are learning virtually.
Well, I'll answer real quickly on that part, then I'll hand it off to Dr. White because there's health issues, I'm sure. In terms of our piece, I think we kind of covered that. If they are on the virtual learning and you can prove that they're aligned with that specific school, that's as far as we would go. And then obviously we'll work with Dr. White and all of your staff when we put out something in writing about games and contests and actual practices. We'll need to make sure that is mentioned. Not only that it's permissive, but what should happen, and this is where I think Dr. White has to interject, what precautions are necessary for the kid that's been gone 2 days and now he's back on site to practice, but he wasn't in class that day. That's definitely a public health issue without question. But our guidance is probably going to require temperature taking when they arrive at an athletic facility. It's probably going to do all the easy stuff, but she might have a more holistic or overall approach.
I'm sorry, about half of that was broken up, so I may not be addressing exactly what you asked. It was the question if someone isn't in school for a couple of days and then comes back to school and participates in sports.
No,
was that what the question was?
If they're learning virtually, and what's the recommendation for students who are learning virtually and participating in sports? I don't know. I'm not necessarily sure that would be related for health. I think it's more for participation.
Well, I think Tony and Dr. White, let me try to tee this up a little bit for you. I think the issue is someone who maybe we're trying to practice at the school every day, but we're not going to classes at all. We're 100% virtual. And I think the precautions that we have in place, the temperature checking and all that would still stand, but I didn't know if you had anything else.
Yeah, I think if I'm understanding, we stick with our basic public health principles of personal hygiene, social distancing, and masking. And it sounds like that you've addressed those, unless the student is actually in the process of a physical activity. They'll be on the sideline, they'll be spaced, they'll be masked, but you're not going to be, you can't social distance in football, obviously, at least not when I used to watch football. And I think a mask would be difficult. If someone wants to wear one, then fine. But I think that's from what I understand. I mean, if it were purely up to me, yes, they'd be wearing masks while they were playing. But I think that physical exertion and the heat, it's just like singing. I mean, we're asking people in the music world, you can sing without a mask if there's, I think we came up with a 10 feet spacing. So you make adjustments. as much as you can to make things as safe as you can. Does that answer the question, Tony?
I think possibly. I think maybe the question can be is, can students still play sports if they're doing virtual learning from home?
Well, yes, ma'am, they can, as long as they're aligned with that school in the Infinite Campus records. How that's done, every school is probably going to have different workarounds. But as long as that's always been the only real requirement is, are they enrolled in that school?
Okay, so they have not been sick. They chose virtual learning through a school method. They can play sports. Okay.
And now, and to be honest, on that, to me, and I'm not a school administrator, but to me, if a school wanted to preclude that, athletics is a privilege and not a right. If they felt they wanted to preclude it, but our rules would not, as long as they're aligned with that school, as long as they're enrolled.
And something for districts to keep in mind, you don't want an unintended consequence of, I know some of you districts have talked about doing a separate virtual school, which you can, as opposed to just enrolling Kevin over here as part of the high school, but in a virtual class and doing NTI. Just, you may want to pay attention to that. If your virtual school is part of your A1 school, it's just delivered virtually, then that satisfies what Commissioner Tackett's talking about. And so you may want to keep that in mind when you're doing. Those are all decisions that you have. We don't care how you classify those during this semester as you're delivering the virtual instruction. But for athletics, you need to tie them in some way back to the enrollment in that A1, even if they're all virtual.
Okay.
And if they're virtual during the daytime and they come on the property and they have not had a temperature check that morning, you can just check a temperature if they've not been there during the school day, but check it that afternoon before they start being physically active. You don't want to check it after that.
Okay. All right. The next question is, can you provide guidance on processes for students who are involved in summer sports activities and staff who are working in summer who have also traveled to Myrtle Beach? Is there a mandatory 14-day self-quarantine, or is this a recommendation?
Well, right now, the governor's office has not issued a mandatory quarantine. We in public health are dealing with two different clusters right now of outbreaks from people traveling to Myrtle Beach. One was in an area where a group of people from one town went together, and the other cluster is a group of friends from about 5 different counties, and they all got together and traveled and went to the same, evidently, facility where they were contacted COVID-19 and brought that back with them. It's very hard. We don't have a good metric, and we talked about yesterday. There's not a really good metric as to who is a hot spot. Myrtle Beach was the hot spot last week, but right now somebody else is probably a hot spot that we don't know about until the cases start happening. Since it takes 5 to 10 days for you to get sick with your symptoms, you may be going to Pigeon Forge, and I'm not picking on Pigeon Forge, that just came to mind, or you may be going to Pensacola, Florida, and there's nothing going on there yet. But a week from now, you may learn that there are a lot of cases, so it's very difficult to pick a hot spot. So we felt like the best thing we could do statewide was say, if the governor says this place is a hot spot and we think anybody from Kentucky that goes there to self, if you happen to be that community where there has been that big Myrtle Beach or White Beach or Brown Beach or whatever beach that someone has traveled to, you may choose to do that yourself, but as far as a statewide guidance, we don't feel like it would be appropriate for us to say that unless the governor issues a quarantine order. Do you agree with that, Commissioner Tackett?
Yes, ma'am, without question. I think the other piece that we would cover as well is we have already said that if we get a situation where a contract with an out-of-state team can't be fulfilled and it's COVID related, we are not going to hold anybody to the terms of a game contract. It's just like a weather cancellation. So we don't want somebody failing to avoid a place they need to avoid for fear of a contract. So we've kind of talked that through with our people as well. We are 100% on board with you.
Yeah, it's hers. That's what I'm saying.
Tony, do we have any other questions related to athletics?
Yes, we do. Sorry, Dr. White, you may need to turn off your incoming video because we're having a hard time with your connection. So you can leave your audio on, but your video might be interfering. Can you still hear us?
Yes, I can hear you.
Okay, we're just gonna try that one and see if maybe perhaps that'll help with the feed a little bit. It was kicking back a couple times, so I just want to check and see if that'll work for us.
Right, and I just got a message that my internet is doing something funky. So if that keeps happening, tell me and I'll go to a different part of my house.
Okay, sounds good. So the next question that I have related to sports is, sorry, it was here and then it jumped up at me. Give me a minute. If a student is sent home with a temperature from practice, can he or she return to the next day to practice?
Well, what we had talked about yesterday, and I hope Angie McDonald's on, I know that Dr. Meserly is on, but according to CDC guidelines, is if you have a child, a student with a fever, then they need to be 72 hours without a fever, without using fever-lowering medications, which is Tylenol or ibuprofen, and no symptoms of anything else, completely asymptomatic, and 3 days without a fever before they can return to school activities of any type. Does that sound appropriate?
Dr. White, that's exactly what we have in our draft because that was straight out of CDC guidance.
Okay, great.
Okay. How does scaffolding athletics, choosing which sports to offer this fall, impact Title V?
I'm not familiar with Title V, but I do know Title IX. And so I'm hoping
Or
that
maybe that's Title IX. I'm sorry. I might have read my Roman numerals wrong. I apologize. That's Title IX.
Okay. Well, at some point, Title IX is in the eyes, the evaluation is in the eyes of the Office of Civil Rights in our local office in Philadelphia. They have indicated, even to the colleges, that they are a little more relaxed right now because people are making decisions around a pandemic. So I don't know that it's going to be, a nail biter on whether or not you have a problem. Remember, Title IX and its assessment is an overall approach to your athletic program, not a singular approach by dropping one team or adding one team. Now, unrelated to Title IX, but actually motivated by Title IX, we have a prime date basketball requirement that requires a certain number of games to be on girls games to be on a Friday, Saturday, or Sunday. I would probably look for some adjustment in that. I can't speak for our board, but I know that's one of the topics we're going to talk about this weekend. Our schools go to great lengths to try to schedule that 40% of their games to have the girls on a prime date. And prime date is not defined by the KHSA or KBE. It's defined by the Office of Civil Rights. And I know they go to a lot of trouble. And if we end up shuffling seasons, that could throw all that out of whack. We certainly are not going to subject our school to sanction over that. But we'll be addressing that with our board to be able to get that guidance out long before basketball games need to be scheduled.
Okay. Another question for you, Julian. How does virtual learning impact NCAA eligibility? Have there been changes?
There have been changes, and we've sent that out once, but I'll be glad to send it out again. The NCAA early in the summer made some changes on two issues. Number one, they are no longer, or at least for now, they're not going to individually accredit virtual programs. And what I think the questioner is asking about is the initial what we used to call the clearinghouse. It's now the initial eligibility center, where they look at your high school record and decide if you can qualify for grant-based aid. So in looking at that, they had some very stiff metrics, what counted what percentage. They have relaxed that on the virtual programs right now because of COVID for the second semester of last year and the first semester of this year. And they're looking to be flexible even into the future if that continues. Secondarily, they also have added a value that's arbitrary but ensures no kid is penalized in their requirement that you have a 2.3 GPA to qualify for scholarship aid. They've assigned basically, if you were to give a pass-fail grade, that grade's going to be translated to 2.3 on a grading scale. So you're neither helped nor hurt. So yes, the NCAA has been responsive in their initial clearinghouse. And if anybody, Tony, has a specific question, if they want to email me, I'll be glad. We have a pretty direct pipeline with their compliance people in Indianapolis and can certainly get a specific question addressed if they need it.
Okay, that sounds good. Another question is what can a student not go to school because of COVID, but then go to practice after school?
From our standpoint, that's the same as whether or not you have a rule that a kid can miss class and go to practice. Now, what we're getting lately, and this may be related to that, is the districts that are talking about a 2-on, 2-off plan, and could the kids practice on the days they were not off, but virtually learning. So they've got, that I believe it's called the hybrid model, as you all been talking about. That would be a 100% local district option. Just like your grade point average requirement, we have a statewide minimum that you got to be passing a certain percentage, but almost every one of our schools raises that rule. Some of you have a rule if a kid's out during the day, they can't play activities at night. That's definitely a local control issue, so you can marry it up with your other rules. From a health standpoint, I think Dr. White answered that. You still got to put them through the paces if they haven't been at school that day, all the checklists.
Right.
Okay. Let me see here. There's another question that kind of relates about the fever. Go ahead.
Yeah, Dr. White, go ahead.
I was going to say, yeah, if someone is in isolation because they're positive for COVID-19, you would not want them back at practice and potentially infecting other students and certainly the coaches.
Yeah, and I apologize for making the presumption, Dr. White, about the on-off education. I think it probably, I would say it goes without saying, but I just made a note to be sure and add that to our draft guidance as we get later in the summer, that the reason they're home should factor into your decision as well.
Right. Thank you.
Okay, so there's another question that in relations to fever and when they can return to sports. There's wondering if they get sent home from practice with a fever, can they return to sports and stay the next day or stay home? Are they supposed to self-monitor for 5 days? Are they supposed to get tested before returning? So there's a little confusion on that.
Okay. So if my child went to school and was found to have a temperature of greater than 100.4, I would evaluate my child and see if I felt that child, if that child needed to have COVID-19 testing. If the child comes home, is afebrile, has no symptoms, and I'm a parent, I personally would have them tested. But if this is a parent that does not want testing and wants to continue to monitor, that if this child is afebrile for 72 hours, has no symptoms, no more fever, and has not been applied with Tylenol to bring their temperature down, and they go 72 hours with no fever and no symptoms of any other kind, then they can return to school. And to me, that would also be after-school activities. So saying they can return to school in 72 hours doesn't mean they can return to after-school activities in 24, and I believe Commissioner Tackett said that's covered in his document.
And I will make sure that our friends at KMEA are aware of that too. We just had that conversation by email.
Okay, and then there was a follow-up on that. There's another superintendent had said to follow up on what you said, Dr. White, a child with fever has to be fever-free without use of fever reducer for 3 days prior to return. But they're saying that earlier guidance had said there was a minimum of 10 days. And they wanted to make sure from the onset of symptoms plus 3 days fever-free. So can you just clarify on that?
Sure, that I can see how that could be easily confusing. The difference is the 10-day had to do with someone who had a positive COVID-19 test. They had to be 10 days symptom-free and 72 hours afebrile. So I think that just got muddled in with the other things.
Okay, so the 10 days.
That was a positive. That was if you had a positive COVID-19 test and you were an essential healthcare worker and we were trying to get you back into the workforce if the fire department, the police department, or the local hospital needed people working. So that's a completely different issue than what we're talking about now.
Okay,
So 72 hours with no fever, no symptoms, and no fever-reducing drugs.
okay,
And I think the assumption is, if you have a fever and you do have COVID-19, you're not going to have a fever one time at one point in time and then not have any other symptoms unless you're an asymptomatic carrier. And that's a whole nother conversation that we're not even having right now.
right.
Tony, do you mind if I follow up with Dr. White? Because this question came up today on the 3-day fever. Because in athletics, unfortunately, as we've seen with people gravitating to go play travel ball everywhere, priorities can get out of whack. Monday, I go to school. Monday afternoon, temperature check, for some reason or other, we do check them, and I am above 100.4. What day can I come back if I'm no longer showing a fever? Is that Thursday or Tuesday, Wednesday, Thursday without a fever, back Friday? Because that, I hate to say this, that is sometimes the game that will be played with sometimes with overzealous people that just want the kid back.
Well, if it's 72 hours without a fever, then I would say that's 72 hours from the time that the fever was found. And if you go 72 hours afebrile with no other medications and no other symptoms of any kind of illness, then so that would be Thursday, depending on what part of the day, Monday, that test was taken.
Thank you very much. We want to be right in lockstep with you all.
Okay.
Okay, and then this kind of is the same, I think it's a similar question to what we asked before, but I want to make sure that they're very clear on this. If a parent opts into distance learning by choice, can the district make them ineligible for athletics?
From our standpoint, yes, there is no right to play sports. That is a privilege that you set up. And forget the mask, forget the virtual. Think of it like we have a state regulation that says you have to be passing 4 hours of instruction. And there's a reason it's called minimum academic requirement. That's pretty low. Every district has the authority to make a rule tougher. Many districts have a 2.0 or a 1.9 or 2.4, and that is the same exact thing. You are raising the bar for participation in a privilege activity, which I think Wayne and everybody else would tell you. If you talk to Wayne Young and all those guys, they tell you that's right in lockstep with what you can do with a privilege.
Okay. All right. There's another question about what they should do for concession stands and ticket sales with sporting events.
All right, let me dive at that one first, because that's probably where we spent the most time this summer. We will include, we're going to put out some game management guidance. Now, it'll have to go through a bunch of people, and it will mirror what's going on with other organizations. We've seen plans from different stadiums and different things, so we kind of know what we need to look for. Without question, you should expect, if you're going to have a concession stand, you should expect some limiting factors. Nothing being made there. You know, nachos are done, prepackaged, those kind of things. The hot dogs are already in wrappers. The chips are already in bags. I think you're going to see that consistent guidance across a lot of states, because that's one of the things we're spending a lot of time on. Secondly, if you can get your way to, we've already had 2 webinars with the National Federation's partner, which is a group called Huddle and GoFan. If you can convert to online phone-based ticketing and get out of the paper money business, you are better off. And I'm not even getting into the whole business officer advantages, fraud, and security at the gate. We're talking about from a health standpoint. You're really going to be better off. We have tried to get people in touch with different people. We had 85 schools on a webinar 2 weeks ago. We would be glad to get our partner to do another one if you're now wanting that interest. But that kind of guidance you will get. And strictly, it's going to be guidance, recommendations. Can't tell you what to do in your district. But we think we're going to be able to mitigate a lot of risk with doing some things. The third thing, and I'll go ahead and say, Tony, because we haven't, it just happened today, so we haven't even got anything out. We're a part, matter of fact, our office is part of the board of directors of the NFHS network, and that is a streaming service. And they charge. There's a premium for that. It's about $10 a month. But we've worked out a way that you can, in your district, make up for perhaps a loss or a ceiling on attendance. And that is that they have released today, they're going to install in any school that's interested 2 free streaming cameras in every school that wants them. And they have 40,000 of these cameras, so they got plenty. But basically, if you're concerned with a 50% attendance limit, which I think we can all gather is kind of the standard number right now on an outdoor event in particular, if you can get that and get these cameras and stream it, then you've got a way that your 50% that couldn't get in, or your cousins and aunts and uncles from out of state, everybody else can see little Johnny or little Janie play, and not only not cost you much, if anything, but they can also afford your athletic program some revenue. We're trying to get that announcement out first thing in the morning. I think it's going to be a great thing for our schools. Some of our schools have already bought them. The units are called Pixelot, and it's a one-time. They're giving you $5,000 worth of cameras, and you've got to pay $2,500 total to get 2 of them installed. You got to get your maintenance people to help with brackets. We've tried to look at all of this: the ticketing, the concessions and/or gate handling area, and the streaming. The only thing I would say, and gosh, I say this to all kinds of groups all the time, quit letting people stream your games for free, because you're still charging the people that come to the gate. Help pay for that athletic program. At least that's, my own personal thoughts. Sorry, Tony, to go long, but I wanted to mention all 3 of those.
No, that's fine. And it looks like our superintendents have a suggestion on what you can call that document. They're saying, can they have a Healthy at Sports document for coaches, athletic directors, principals, and superintendents? So there's a suggestion for you.
I appreciate it. And to be honest with you, we are trying to be a little clever with this final document that talks about attendance, whether it's healthy at games, healthy at sports, whatever. We're stealing the best ideas that we've seen, as well as from other states. There's 1 and 2 page summaries. We want to try to give them everything they need to arm themselves with knowledge, and then hand it off to their staff that does it. We need to make sure the superintendents are armed with knowledge.
Okay. All right. Let me look and see if there's some other ones here for athletics. Okay. So now there's a question on the crowds. Right now, we can't have crowds of more than 50, correct? That includes groups of teachers together or fans at ball games.
Right now, as I understand the guidance that came in the 29th, the group limit is 50, and other limits have been approved, but with a separate request. That's one of the topics we'll be talking about. I can tell you that we'll be looking to use the 50% model and the ability to socially distance within that 50%. I know some of our high school stadiums, you could cut the crowd to 50% of capacity, and it'd be more than they ever draw. But we still got to spread them out. So there's a variety of things that we will work with both Dr. White and all of her peers about. You might look at the church document for a pattern. You might look at Kentucky Kingdom for a pattern. You might look at the racetrack for a pattern. We're going to try to get, as we get closer to competition, which we are not close to competition now. This is July the 7th. And the first sport we usually start is the end of the first week in August with golf. We have time, and therefore we can also see what may not be working in other places that have tried the expanded capacity.
Okay. All right. I'm going to keep scrolling to see if I can find another one that has to do with athletics. Give me a minute. We already addressed the 14-day self-quarantine. There is no quarantine policy in place right now for kids who go out of state. But there is, if that's something that a local school or something could possibly put in place.
Yes, ma'am. And we will probably, Tony, in our guidance say that should be a consideration you decide at the local level. Give you a checklist of things to talk about, so nobody, because they didn't see it listed, doesn't talk about it. Because they've got to work with their local Department of Health on whatever's finally adopted.
Right. All right. I'm trying to think. If a student tests positive for COVID, are his or her siblings allowed to practice if they play sports?
Well, if they're living with those siblings, then those siblings would be in quarantine for the total of 14 days from whenever that quarantine period started. So, no, they're being quarantined because they are potential vectors of that infection. So, again, you don't want them infecting the rest of the team and the coaches, trainers, other staff.
Okay. All right, I am looking to see if there's any other ones that I have missed. There's quite a few in here. I just want to make sure I haven't missed any other athletic ones.
I do
There is a question.
Go ahead.
Go ahead, Julian.
Well, the counting of the 50, Dr. White, do you have guidance? You know, we got into a little bit of a contest with one of our school districts, a not so desirable contest between personnel that were saying that the doctor or the team doctor had to count against the 50, the trainer had to count against the 50. One other person said healthcare people don't count. Have we drilled down that much, or is 50-50? Because that's the way I thought there was 50-50, but I don't want to look bad by not hearing something you might have said.
My understanding is 50 people or 50 people.
That's exactly my answer. Thank you. I was paying attention.
Very good.
Okay, sounds good. Let's see.
See, Kevin, it paid off me listening to all these meetings with her.
I don't know if this, I'm not sure if this might pertain to athletics. What is the guidance on use of outside playground equipment? I guess it maybe not particularly athletics, but maybe, I guess, depending, maybe not, but we could perhaps answer that question right now.
Hey, Tony, this is Kay Kennedy.
Okay, Kay.
That playground equipment is addressed in facilities document. And again, you know, with social distancing on the playground and all of the typical mitigation, but cleaning should depend on the surfaces and the frequency of use. Other than that, I would cycle it in your custodial duty worksheet to make sure that you address it as frequently as is needed for different groups moving to the playground at different times during the day. So try to sanitize between groups. I would suggest you might want to think about the use of some kind of disinfectant that might, I don't know that one exists, but that might be sprayable that you could use in a large area like that. Again, check your product labels and put that into your schedule, and it should be taken care of just as part of your regular custodial duties.
Okay.
And certainly public health, just as we very much understand the importance of children going back to school for their emotional, physical, and mental health, we're very strong on recess in public health, and I know that's an issue in a lot of schools that there's not that ability, but we are very supportive of recess and in that time for the kids. And we talked, I think, in our document about when kids are outdoors and if they're social distancing, they don't have to have their masks on. So we were seeing that as a potential break during the day for children to go outside and do that.
Okay, and then there's another question right then for Julian. What do you mean by a special request? How do we do that to increase crowds?
No, we would make that on behalf of our members.
Okay.
Just like all the racetrack, we're going to try to come up with guidance that can be authorized by both the governor's office, the public health people, Kevin's office, and it would basically be a template for everyone.
Okay.
And
so
then
it's not like an individual district by district, it would just be for everyone.
Well, that would be the initial intent, but I don't think there would be anything that would preclude someone else from making a request. Okay. But I do know I've been told they're trying to streamline this. And I know that based on even recent judicial action, we've got a pretty good template in mind that we know would stand a challenge. So that might help.
And there's also a big difference you mentioned, Commissioner Tackett, between indoor and outdoor sports. I think that's going to be apples and oranges as a difference in attendance.
I'll be honest with you, Dr. White, I'm more concerned about trying to have volleyball this fall than I am football. And that's, that may be a hard-headed statement to make, but I'm telling you everything, and we keep getting, CDC keeps sidestepping, adding anything about indoor venues, and you, depending on who you read, it's political, it's health, it's whatever, why they're not addressing it. But if we get more guidance, that would be helpful from the CDC. But right now, I would say that volleyball is going to be a bigger challenge, and certainly basketball as we get closer to the winter. Luckily, we have a lot of time between now and basketball season, and hopefully either a treatment and or, vaccine gets further down the road to make people feel comfortable. I tell you the thing our schools are going to have to address, quite frankly. It may not be an if you build it, they will come type of thing. There's a number of people that are going to hesitate getting back out at contests, and we know that, and you all do too.
All right, this may be a question for legal as well. Can we legally require kids to get a COVID test to return to practice after coming back from a trip?
Ashley Lant is available to answer that question. She researched it, I believe, yesterday.
Yeah,
Ashley?
hi, thank you, Kevin. Thanks, Tony. So this question came up yesterday during our superintendent advisory council meeting about whether we can mandate COVID testing for students. Based on our research and some personal liberty interests, there's not really a basis to mandate COVID testing at this juncture. That's certainly not supported by any statute or regulation that we have in the state presently. Of course, consult with your local board attorney on that specifically. I would direct superintendents to KRS 158.160, which addresses communicable diseases. It does give the superintendent some discretion to exclude a student from school for a reasonable period of time if they're suspected to have COVID. So if you have a student presenting at school with a fever of above 100.4 and there are other symptoms present, that's certainly something that you would evaluate whether you could proceed under 158.160. If your district utilizes KSBA for your policies, this is incorporated into your policies generally around 09.213. So just something to be aware of there. Thanks.
Okay.
Thank you, Ashley.
You're welcome.
All
Thank
right.
you.
And let me see if there's any other ones that require athletics. Otherwise, we can move on to our next item on the agenda. Oh, wait, I will mention, because the band was brought up, I do want to mention this. Has there been any guidance for band? So I do have good news for you. We did hear from John with KMEA today. And their guidance has been approved by the governor's office and DPH. And the other good news is that he is able to appear on the webcast next week to answer any questions that you may have. Robin Keeney, are you on?
I am on.
Did he say he was going to distribute that to his membership or?
Yeah, I think he did say he was going to distribute to his membership. I don't think we have it posted yet under our other guidance section at KDE, but we'll work to get that up.
Yeah, we will work to get that up, and when we send, I'll tell you what, I can make sure that you all get a copy of that because I know you've been waiting on that for a while, and we just got that within an hour before the webcast went live, and we will send that out to you as well via email. So look for that in your email, and it'll also be on the KDE guidance document from other resources, part of the website on COVID. So, and then also next week, he will join us to answer any questions you might have in regards to that guidance document.
Tony, I don't want to speak for Dr. White, but I want to thank her because I've been in on that loop with them because obviously we work together even though they're a separate group. And Dr. White's been extremely helpful with the review of that. And I think that the superintendents will appreciate the documents, not only because of their comprehensive, but because they address both in-school band performance and marching band. They've looked at both of those. So that's really good that we're getting some clarification. It just shows that all of us are making our way down this path.
Great.
But thank you, Dr. White.
All right. Well, that sounds good. I think that will do it for our athletics related questions. And we can go ahead and move forward to the next part of
Tony, before we do
ahead.
that and while we're giving thanks, I want to thank Julie and Commissioner Tackett. This may be the last time we're on the webcast together with me as interim. And I remember the day we had the phone call with the governor, and I remember the silence on the phone with you because you knew what had to be done. And that was the first or second day, I believe, of the girls' tournament. And you did what you knew had to be done for the health, but you also knew because of your fiduciary duty and your dedication to the association, what that would do to the association. And I just want to reiterate publicly my offer to you that I will sit with you at whatever legislative committee, go with you to whatever bank or whatever is necessary to support the association, because you all did what had to be done for public health. And I just want to thank you for that.
Well, Kevin, thank you. And your all's communication's been outstanding. Even though you're going to step outside of these meetings, I probably won't get to. So I'll be glad to call you and tell you what's going on. But it has been a great partnership. We enjoy working with and for both KBE and KDE. And I know that you and others relish the opportunity to get back to only doing one job. So I do thank you and wish you all luck. And we certainly appreciate any help that anybody's able to give us. We're trying to stay alive, and we think we perform a vital service, and we're just hopeful to keep doing it. But thank you all very much, and sorry to take so much of your time, but it was obviously needed.
Yeah.
Thank you, Jillian.
We appreciate it, Julie, and I know our superintendents appreciate it as well. So thank you.
All right. Thank you all. I'll say goodbye.
Thank you.
All right, I'll go back to sharing my screen and make sure I have the right one up here. Sorry, it takes a minute. All right, are you guys seeing the screen? Yes. Yes? No?
Yes.
Okay, just making sure. All right, Angie and Kay, you are up.
Great, thank you very much. So the next reopening guideline document that KDE is putting forth is for workplace health and safety. And our guiding question is, what supports do districts need to implement the safety expectations and best practices for health and safety to reopen schools? Next slide, please. So our document really addresses these 5 major topics. One is your local district health and safety team, health resources and support, mitigation strategies that you will be employing throughout the district to protect students and staff. And then we'll talk specifically about employee health and wellness and steps that you might consider there to ensure that you keep folks safe. And then a similar conversation about student health and wellness, and we'll get into those obviously during our presentation. Okay, that being said, I am going to share my screen and let me know when you can see that.
Okay, we can see it.
Okay, great. So in this document, we do include a number of links to either already existing guidance that we are building on and utilizing, or directly to CDC or other professional organization guidance that we think can provide some assistance to you as you go through your summer planning activities. The first link that's included in the document, and if let's click on this here and make sure that we can see that as well. The CDC does provide a decision tree type document that will allow you to consider what's important to opening schools. When should you open? When do you not open? When do you consider some sort of additional closure, intermittent closure as you go throughout the school year? Again, it's very important that you work closely with your local health department to make sure that that everybody is on the same page. Oh, wait a minute, so go back here. Also in our document, we consider the Department for Public Health's guidance on Healthy in School to be the flagship document, and we are going to be the little tugboats and the barges around that flagship to keep it moving and to hopefully provide additional guidance to districts as they implement various parts of that. So the first thing we'd like for you to consider is your local planning team, call it what you will, but a large part of what they need to consider are the items around health and safety. And one of the things that we have heard you loud and clear is that there's a lot to cover. How do you keep your eye on the ball? How do you get your arms around this? So this link will take you directly to some CDC guidance that provides a readiness and planning tool that includes, let's see if we can go to the next page, includes actually a checklist for various activities that you want to consider as you move through planning. This is the general readiness assessment. There's a daily or weekly readiness assessment along with some additional planning tools. But notice here you have a checklist of activities that you should consider. Some of them may or may not be applicable to your particular situation, but allows you to identify a point person in your organization who can ensure that at least you've considered all of the appropriate steps that need to be taken. The categories that they cover are policies and procedures, facilities and supplies, education and training. And as we move forward in this, additional items in the checklist in the general readiness section, general readiness, and then we come to the daily or weekly readiness assessment. And if you just look at a couple of these, if you get an opportunity to bring up that document as we're talking, notice the middle category, facilities and supplies. Identify a point person, might be your plant operation manager for the district, might be the head of custodial services, but some tasks that should be in that person's line of sight. Monitor and restock supplies. Monitor adherence to the schedule for increased routine cleaning and disinfection of all of these various items. And you may have other things that you want to add. But it's important to note that there is help out there to assist you with getting your arms around this. And as we move to a very important consideration will be, what do you do if either a student or a staff member gets sick? So again, here's a checklist. You can develop flow charts from that. You can develop your own policies and procedures. And all of this serves as a tool to allow you to better communicate with your students and families, any special concerns or any special activities. And I heard on a call today with on a live stream today with the White House, one of the most important things that you can do with your school community is to make sure that you stay in good communication. So as we move through the document, again, helpful links directly to the CDC interim guidance for businesses and employers. You are in a business. You're in the business of education. You've got to open your doors to students, staff. Think of the students as your customers. Think of the staff as your workers. And how are you going to keep them safe? Okay. So again, different topics to keep in mind, and we'll be happy to take questions when we get to the end of our presentation. But right now, I'd like to turn the conversation over to our state school nurse consultant, Angie McDonald. Angie?
Thank you, Kay. As I was a school nurse in my former life, when we were developing and working the past several weeks on our guidance piece, the Healthy at School guidance, I started making notes to myself as what questions would I have as a school nurse once I had this guidance piece? How can I make this happen and plan for my individual district and schools? So that was kind of where my concept for my section of this document came from. The first little section there kind of describes my position in this as a state school nurse consultant. I'm kind of the school nurse for KDE, I guess, for lack of a better term. But my job is to provide leadership and assistance to school districts regarding their health services. I try my best to do consultation, technical assistance, help them develop some quality improvement areas. And a lot is just to be a shoulder to lean on and someone to that understands when school nurses are very overwhelmed and just need someone to talk or vent to. So I've done my best to try to include guidance from many reputable agencies across the state and the U.S. And of course, right there at the front, I have included a document about the role of the state school nurse consultant in the return to school planning. I've been very fortunate to be able to network with school nurse consultants all over the country, and we've been able to virtually sit down at a table together and share ideas and share positive things, and that we've kind of, because we're all in the same boat. Our situations are a little different, but we're still dealing with the same major issues. I've listed some additional duties for the school nurse in response to COVID-19. These ladies and gentlemen are so busy as it is, but this global pandemic has just opened up a whole new can of worry and concern to protect students and staff. So those individual things that the school nurse are going to be asked to take on this year are listed there, such as providing extra instruction to staff and students on how to protect themselves, the importance of using PPE correctly, how to use PPE, how to use proper hand hygiene, covering coughs and sneezing, and just things that the kids can even maybe teach their parents, little things at home to make things safer for their families. Down at that section, I've included some helpful links for school nurses. The Asthma and Allergy Association has a great flow chart on asthma care at school, and it focuses on if a child comes in with coughing and sneezing and that sort of thing, it helps the nurse kind of better assess them as to, is this maybe an allergy flare-up? Is it an asthma attack, or is it COVID symptoms? So that's a very helpful document that I've included. And then I've also included guidance from the National Association of State School Nurses on the school nurses' role in coming back to school. You know, we encourage our school nurses to be at the table developing these plans, because they know your kids better than anyone, and maybe even will think of things that you haven't thought of when you're doing this plan. The school health room, it's going to be very important this year. It may be your most important room in the school for the upcoming school year. And it's always an issue with schools because of limited space. And I understand that completely. My first nurse's office was pie wedged, and it at the widest point was about 4 feet wide. And so I know how cramped it can be, but it's very important that we try to make this room as safe as possible for your school health staff as well as your students and staff. Proper ventilation is a key to prevent the spread of COVID. Ideally, that school health room would have a sink, a private bathroom, and windows that you could open for ventilation. But I understand, you know, we can't make you can't build a new nurse's office, but you may need to consider moving that nurse's office to a place with a bigger space to spread out students, so they're not waiting out in the hallway to be seen by the nurse, that there's a water there for them to be able to wash their hands, etc. We'll go on down. We've talked about PPE. I've listed all the different types of PPE, a little description of what they are, the use for them, and then some helpful links for the school nurses on how to optimize your supply of PPE, face mask considerations for school nurses, when you should wear gloves, and then using PPE. And they're included in here are some great little short videos or posters that are all free for the school nurses to you could use in classrooms or to hang in hallways or send home with parents. The same thing goes down for masks. Of course, I think, have all kind of come to the understanding that all students first grade and up should wear a cloth mask unless there's an underlying health condition and has an exemption, or if it's in the student's IEP, of course. We've also talked about social distancing. We're not going to make a child on a ventilator try to wear a mask, and staff that need to provide that one-on-one care for that student, of course, is going to have to break that 6-foot barrier, and they just need to make sure that they're wearing proper PPE and using proper precautions and good hand washing. Talked about hand hygiene. I encourage school nurses to get a lot of your little specials teachers, especially in elementary school. My librarian was a champion that she would do all kinds of little lessons and classes on different health issues. And they may be able to do that. They did things in art class, they did design posters. So try to use your resources as best you can, because a nurse isn't always going to be available. As much as she wants to be in the classroom teaching these things, she's going to be on the front lines seeing kids and staff and trying to keep everyone safe. So we need to use as many resources as we can. We've talked about social distancing. We've got links on that from the CDC. We've already talked about temperatures. The CDC recommends anyone be sent home with a temperature greater than 100.4. We're also advocating that you use non-touch thermometers. If there's one not available, try to use the temporal scan or the tympanic thermometer, because the old-fashioned under-the-tongue thermometers can spread respiratory droplets. And plus, that's a very expensive, the probe covers can be very expensive to the school. Any student, we're asking that you check temperatures when that student gets to the school property, whether it's dismissal from the bus or have an entrance for students who may walk to school, or even at the car rider line. The best case scenario is you catch those kids before the parents pull off in the car rider line, you check their temperature, and then put them back in the car and, instruct mom or dad to get medical treatment. And I'm going to turn it back over to Kay. She's going to talk about employee health and wellness.
Thank you, Angie. So it's very important that you stress to your employees that please stay home if they are ill. Here at the state, if we enter one of the state buildings, you have to fill out a log each time you enter and monitor your COVID-related symptoms so that they can use that information if contact tracing is needed. And we provide a copy of that log in case you want to use something like it or model that for your own facilities. And that should be at all sites where employees perform their job duties, whether it's a bus garage or in the building, or if you have a separate facility that does food service, etc. If an employee has symptoms, you need to decide how you're going to handle that. And then there's guidance. These links take you to the CDC guidance on what to do if an employee presents with symptoms, and what type of quarantine they should be in, and how you're going to ask them to return to the building. So again, the guidance is here directly from the CDC, and we ask you to please consider that as you write your policies and procedures. If you do have a remote work option and employees can do that, that certainly is helpful to keep them busy and contributing to your school district if at all possible. So again, we have a couple of helpful links here. Considerations for the school nurse regarding care of students and staff that become ill at school or arrive sick, and then what school nutrition professionals and volunteers need to know about COVID-19, how you're going to treat those who may be working in jobs that either they are high risk themselves or that they work with students in a very close relationship, such as your cafeteria workers. Similarly, we have student health and wellness section in the document. As we've talked about before, temperatures should be taken upon entry into the building, or if you've done temperatures on the bus, sometime before the school day gets rolling, do a health assessment on your students. And again, this can be an exception type testing. You don't have to record temperature of every student, but if a student presents with a fever, that's the student you should be concerned about. Everybody else move through the line. So your health screening protocol should be mapped out and clearly communicated to your families so that they will know what to expect if a student does present with symptoms, and how you are going to contact them and expect them as parents to react to that contact. The same thing is true about how a student can return to school. Again, communication will help quell a lot of fear and unrest on the part of your family. So the sooner you can get that worked out and communicated, give folks time to get used to that, I think that would be very helpful. And again, other resources that might be helpful to you. This particular CDC communication resource does involve a whole social media toolkit for COVID-19. There's a press kit, a digital press kit. So again, I would encourage you to take a look at those. Utilize what you can. There are a lot of free resources available on the internet with respect to signage. So please take a look at that. So finally, we do have a couple of items in the appendix. We've talked before about it being a little bit difficult to get temperatures taken on the bus. So you might want to have parents assure you through a daily health assessment that they've done at home that it's okay for their student to get on the bus. And this is just an example. We'd certainly recommend that you clear it with your local board attorney on any kind of attestation document that you want to get assurance. Here is the sample employee health self-assessment form that I think from the state perspective, they expect this to be turned in at the end of a pay period, just so that they know for contact tracing purposes who's been in the facility and whether or not they've had any symptoms that need to be of concern. Okay, so all right, that's all we have relative to the workplace health and safety document. And that being said, I will turn it back to Kevin or Tony or somebody.
Tony, if we want to start with questions, and I think if this will be similar to the Superintendent Advisory Council yesterday, the questions will probably take us naturally into the next subject with our friends from Department of Public Health. So we'll just do it that way again today.
Okay, sounds good. So we'll just go ahead and I'll just start from the top because again, they're going to probably relate to both of these topics. How can students and How can students and staff be safe for 6+ hours in a school building? They're saying that there is evidence that science suggests that COVID is airborne and lingers in the air and may spread indoors by poorly ventilated HVAC systems. And that is at the top of the list for questions.
So this is Kay. Again, in our facilities document, we talk about some of the recommendations from the ASHRAE group that talk about ventilation and diffusion and filtration. So there's techniques that we strongly encourage you to take a look at. You might want to think about changing the air filters in the HVAC system a little more frequently. Again, there's going to be cost associated with that. Open the windows when and where you can, allow for that circulation. But again, the use of face masks and social distancing and the hand sanitization are just the key components to help ensure that we can keep the school as safe as possible.
Dr. White, do you want to comment on, or Dr. Meserly, about the length
Sure,
of time of students in a building?
So this is Emily Meserly. Dr. Meserly, can you hear me?
Yes.
Yes.
Okay, because I'm on a headset. Yes, so we have been in communication with our environmental folks. Becky Gillis is the director of our environmental branch, and she is just on this specific topic. She is arranging some trainings with the EKU environmental hygiene department, and they will be offering trainings to school staff on specifically this topic. So we will be sending out a link to register for those soon. I believe she wanted to know if there was a way that we could find out what day or time worked for school staff as far as those kind of trainings. So maybe that's something that Kay, I can get with you on figuring out what a good time would be to offer those trainings.
That'd be great. This is a class that we had talked about was going to happen, and then it actually is going to happen. So I think that Eric Brakefield sent that to Rob and Kenny this morning. So we'll figure out what will be the best way. So this will be for KDE staff, custodial staff, or whoever in your facilities, and it'll also be for local health department environmentalists, so they can be of assistance in different parts of the state. So I'm very excited to be off this. I believe it was going to be about a 2-hour class, if I read that email correctly while I was on other conference calls. So, and again, that's why, we know there's 2 types of droplets that come out when you're speaking, singing, laughing, talking. The heavy droplets are the ones that come and land on the soft, hard surfaces. That's why the hand hygiene is so important. And then there are the smaller, even smaller microparticles that will stay in the air for a longer period of time, which is why the mask is so important, especially if you're moving or you're less than 6 feet apart. That's why that is so crucial for that time that you'll be together. And with the breaks, like getting up and going to a cafeteria for different breaks. And then we talked earlier today about recess time and getting the kids out of the building and outdoors so they can take those masks down if they're in an outdoor setting. As much of that as you can provide will make it all healthier for the kids.
Also think, Tony and Dr. Meserly and Dr. White, districts, and that's probably why this is the most popular question right now. They're hearing from their community and their parents that, and I'm putting words in there for them, but I believe what they're hearing is just, even if they have the best, most super duper latest technology, air filters, and doing all this, their communities are still going to express a distrust or a fear of having their students in a building for 6 hours under conditions like during a pandemic. I don't know, there's not an answer to this issue, but I think that's why they are asking this and why it was such a popular question. Another thing that we did put in the flagship document that I keep forgetting to bring up, and this was always I was in school back 100 years ago, was and everybody looked at us like we were crazy, and back then. But now that's a perfectly good opportunity to get the kids again out of a building and give them some type of a break while the weather will still allow that.
So, Dr. White, can I bring up the guidance from Massachusetts and the Children's Hospital of Philadelphia that you and I discussed?
Sure.
So we definitely listened to the White House live today with a lot of the guidance from the American Academy of Pediatrics. We've also been looking at guidance from the state of Massachusetts. Massachusetts has a very robust school reopening guidance utilizing infectious disease experts from Harvard and Brigham and Women's Children's Hospital. And they really have a very strong evidence base in their documents, and actually speaking to the maximum of 6 feet but minimum of 3 feet, and that is really what Dr. White had put in our guidance. If 6 feet of distance cannot be maintained, then masks must be required. So in classrooms where you cannot maintain 6 feet of distance, really all of the most respected academic institutions and national guidelines are stating that you can go less than 6 feet, but then you have to have a mask on. The masks have to be part of that. So it's not being apart 3 feet and no masks, but being apart 3 feet, yes, masks. And there's lots of evidence base to that with the droplets and everything.
Thank
I'm
you.
reading a question that says CDC definition of fever is 100.4 or greater. Why is the guidance for students to send them home if they have a fever greater than 100.4 instead of 100.4 or greater? That's a very simple answer. My boss is an ED doctor, and he says the definition of fever is greater than 100.4. And that's what the definition of fever is greater than 100.4. That was the training that he received. That's, if you are in an emergency department, that's a pretty standard definition. So that's where that definition came from. So we're consistent. We at DPH are consistent with that definition.
Okay. The next question I have is they're saying that they need additional guidance, perhaps a flow chart for what needs to happen in terms of teacher and staff leave, such as sick or emergency due to COVID exposure. And the flow chart would need to contain info on type of leave and who would pay or who pays.
And we can handle this one, Dr. White. I don't know if Ashley or Rob and Kenny want to comment on this. This is something we were actually in discussion with the Lieutenant Governor's office just before this webcast on some of these outlying issues that we still have out there. So we understand that. We understand there are new federal leaves that are out there because of COVID passed by Congress. There was an emergency leave provision in Senate Bill 177, but that only applied to last semester. It looks like that I will be recommending, and we will be probably implementing that through a waiver or a memo through the next semester. But I know that may actually even complicate it even further because you've got another leave provision on the table. There's already the provision that districts can increase their number of sick days, and then you have your normal sick days, and then you have people that don't have sick days because they've used them all, and then issues of, well, what about somebody that tested positive or somebody that went to Myrtle Beach and is a high-risk area but needs to quarantine, but somebody that wasn't, all those things. Some of those are going to be local decisions. But we are looking at that issue and can provide some guidance to you over the next few days and weeks in writing as to the different leave provisions and how they may apply, and then maybe any need for any local type policies that will need to be implemented. Ashley and or Robin, do you all have anything further on that?
This is Robin. I would encourage districts once again to look at materials that we've provided in the past, including those provided by the Department of Labor, because that helps us to understand the federal leave provisions, which are both emergency leave and also extended Family Medical Leave Act provisions. They do have differing requirements, and they do have an ability, they have some timing constraints on them, or timing allowances, I guess I should say. So it's important as you're looking at the leave requirements that are offered by your local school district, as well as the ones with the federal requirements, there may be opportunities for employees to exercise those and be more advantageous based upon the timing and allowances offered. So I would encourage, and then I will also just channel Todd Allen on this part. We would always encourage you to consult with your local board attorney on this as well.
And I know KSBA has also issued something in the past. I think we have issued something on the FMLA and the past webcast. We may need, and we can talk offline about this, Robin and our legal team. I think Todd is off with the board right now, but about whether we need to bring some of those documents, or at least have maybe another document bringing some of the other guidances together in a 1 or 2 pager that can be assist districts and also board council in this with this issue.
Okay. This one I think is also going to go to Robin's department, probably food services. Are districts expected to offer meals to virtual students? If so, is it pickup only or expectation to deliver? And will it be for 5 days a week or 7 days? And if it is 7 days, students that are in person, would they receive the additional 2-day option?
Wow, that's a lot of questions for food service.
I know. Do you want me to repeat it again just so you have it?
I'll start with some of them. Lauren Moore, who is our director of food service, has actually on a well-deserved vacation this week.
Oh.
So we'll start with some of that. I think we have to remember there have been waivers granted by USDA, which allow for some flexibility. We are moving back into the National School Lunch Program, away from summer feeding. So the rules about summer feeding and who you feed during summer feeding and when you feed during summer feeding, we need to shift back to National School Lunch with the flexibilities of non-congregate feeding and all that applies around that. Districts, we would encourage very much districts to provide meals to those students that are operating under remote instruction. It's really important because there may not be other ways that these families and their students that typically rely upon that food service in your building to have access to that food. We continue to say and see on TV that our food banks are really strained, and there just may not be other options for them. How you intend on doing that, the Division of School and Nutrition is providing and having conversations with your food service directors. I would encourage you, as we have done in the past, to try to pick a model that is sustainable, because we don't know what that's going to look like down the road. I know in your eagerness and also just your pure passion for servicing students as we were closing down last school year, lots of districts provided that delivery really to very close locations to their students, or even some door to door. And that became a very difficult model to sustain. You'll also be able to, under the waivers, to provide multiple meals over multiple days, which gives that flexibility. So try to think of in terms, and again, this is a local decision, but think of in terms how you could create a situation if you're doing that alternating days for students. Maybe they come in person a day, and you find a way that they can take meals home with them for the next day if you're alternating like that. Or if you have some students that are in person, go ahead and do your cafeteria or your in-classroom meals, and think about how you can provide multiple meals to students for 2 or 3 or 4 days at one time with a pickup. So we're just starting to hear back from food service directors of them thinking about what that would look like. I would rely very much on them. They are very creative. They were creative when we were ending the school year on how we could access meals to students, and they'll be good partners to have at your table as you explore that further. I will also pass this question along to Lauren Moore in our school and community nutrition and their staff.
Okay. All right, make sure I'm not muted. Okay, there we go. All right, our next question is going to relate to kindergarten and preschool. Please clarify the expectation for kindergarten and preschool students. They are not expected to wear masks, but what are the requirements for social distancing for them?
Dr. Meslin, you just got off that call, so I'll let you take that one. You're on mute if you're talking.
Okay, sorry. This is Emily Messerly. Can you hear me?
Yes.
So I was, yes, I was on a call earlier with the childcare group, Sarah Hanover's group, and they were talking specifically about their pre-K and preschool and classroom. Now they do not have specific social distancing guidelines in the preschools. So your kindergarten and pre-K would really be treated similarly to that. You're going to have cohorting. Cohorting is very important, that groups are kept together and that hand hygiene is utilized. But we do know that those groups are not developmentally able to stay with masks on all day, so we don't require masks. But social distancing in those groups, as best as you're able, as best as feasible. If they are sitting at desks, yes, try to separate them, but knowing that in the daycare setting, that's not always possible, so preschool and pre-K will be similar.
Okay. All right, our next question, do we have anybody from, I don't know, I'm not sure if Greta is back or someone from her office on the call today? The question is, does every student who brings back a doctor's note exempting them from wearing a mask have an IEP 504 or IHP? Can we mandate those students receive their education through an online or virtual option? Or do we need to flag that one?
This is Ashley Lant, just filling in for Todd today. I'd be happy to take a look at that and provide a response.
Okay. And just a reminder to our superintendents, our yellow sheet is back up and updated, and you can find that on our COVID-19 website. That's the Q&As that we have provided for all of our websites and pretty much everything since the beginning of our COVID experience together. We have all of our questions and answers up there for you. We've been updating that. We now have that updated by the week, sometimes twice a week. So be sure to look up there if you have a question that you believe was asked at a previous webcast. We're getting that updated pretty quickly now.
And I would just ask that we will flag that, Karen and Tony, if you will both flag that for next week to begin the Q&A with that next week, that question. So while it's going to be in the yellow document, I want to make sure we talk about it on here as well.
Okay.
And this is Kelly. I'll just add to that too. Greta's office, their guidance will be released on July 20th. So there'll definitely be some additional guidance coming out regarding special education.
Okay.
Yeah, thank you for that, Kelly.
All right. Our next question is, if a staff or teacher or staff member is quarantined for an out of school, is exposure to COVID, what type of leave do they take? What if they're exposed in school?
This is also part of the discussion we were having earlier today with other agencies. We understand this is an issue. Some of it was going to have to be handled locally, but we also understand we need to maybe put together some additional guidance, or at least put together previous guidance into one location on leave. So Ashley, if you'll also flag that is related to the other leave issue.
Will do.
Okay. We'll mark that one there. All right, and this one also may have to do with this as well, but it's also marked by a couple of people. When an employee has been quarantined per the federal emergency leave policy, does the school district pay for their leave out of their original funding source or code to CARES? Specific employee examples: Frisky, KDE, MOA, Title, Fund 1 and 2. Question mark.
So that's a question regarding use of federal funds and what would be allowable or not. Not sure we can have an answer on that one right now. Robin or others, Kelly, is this another one
Sorry,
to flag?
Tony, I was answering a text. Could you read that again?
Sure. When an employee has been quarantined per the federal emergency leave policy, does the school district pay for their leave out of their original funding source or code to CARES? Specific employee examples, Frisky, KDE MOA, Title, Fund 1 and 2.
Hey, Kelly, go ahead.
I was just going to say, we're going to need to flag that one because obviously we'd want to use CARES if at all possible. And then we also don't want to get into supplement and supplant with title fund. So just flag that one and I'll work with Robin's office unless she has an immediate answer.
No, we'll work on that too and try to give some guidance to districts on how to code that as well.
The other thing involved in that question, there was a talk of quarantine, and then there was also a talk of or mention of FMLA. I believe the emergency FMLA that was passed out of the Emergency Act of Congress, and I believe those two were kind of joined. Those may not be the same thing. You could have an employee that's quarantined that's unrelated to FMLA for other reasons, or it could be. So
that leads us to the next question, which is please explain what is expected use of leave in parentheses FMLA, sick days, etc. for when an employee certified and classified must quarantine. So there's a lot of questions around this particular area.
Yep. That's definitely the subject of the week to this week. Very good one, very complicated, and we will work to get you to collate the guidance together, combine the guidance that we've already issued, and then also address any new questions by next week.
All right. The next question is, could a portion of the elementary school day be performance-based? For example, could 30 minutes be virtual that is done at home that would count towards the 1062 minutes since some students are doing entirely remote learning?
This is the day of the flagging.
I was just going to say, I didn't know if I was muted or.
No, I'm not sure if that question, because if they're already doing remote learning, obviously some of that could be project-based, just like if they were in face-to-face learning. So yeah, if you'll send that one to me, Tony, we'll make sure we get an answer for next week.
Okay, that sounds good.
And this is Robin. I'm not sure exactly which aspect of that question, but for, when we talk about performance-based and how that triggers funding, we don't really need to worry about that as much because now we're going to be looking at a different model for attendance. So we don't have to look at it that way. I also am not sure that elementary schools can participate in performance-based activities in the first place. I think and I might need Ashley or Todd to kind of weigh in on that, but we talk about performance-based really for high school students.
Okay. And I can tell you Todd is tied up with the board right now because I'm in the room next door. So
well, and also this is we're getting down into some of these questions. They're very complex, and as good as our team is, sometimes we just have to go back and put our heads together and we don't have the answer right now, unfortunately. I apologize for that, but we will get it and we'll make sure we cover it next week.
Okay, the next question is, can a middle school teacher who can't come to school for health reasons oversee the elementary students who are doing virtual learning?
Hey, this is Rob. This is a certification question, and the answer basically is yes, assuming that you're using some sort of a platform and that middle school teacher is facilitating the learning, much like you would in a credit recovery type of situation. Absolutely. There are also other ways that you can work around if someone else in the district has prepared all of the instruction and that teacher is the teacher of record and you have an additional teacher who's the middle school teacher helping. We can certainly be happy to consult with you on that specific instance, but that is absolutely something you can look at doing.
Okay, sounds good. The next one is, go back down here. Are high school students being allowed to change classes or must they stay in the same classroom all day? If they are allowed to change classes, is there any guidance regarding how many classes per school day a school should schedule?
Well, ideally, you want to cohort the students, and I know we've been talking about this for a long time, The more a classroom of students get up and start moving around, that's going to complicate contact tracing when you have a positive case. So there's not really a rule of 3 classes, 5 classes, 4 classes. It's however much you can do that is practical and reasonable in your school is what you want to, how you want to do it. The more you can move teachers, the better. I understand that that's not practical in every situation.
Okay. All right, the next question is, here's another, it's going back to the face shield question. I believe that we've talked about in previous weeks. Can the face shields with the extra long and wide drapes at the bottom substitute for masks, especially with teachers who work with students for special needs?
No.
Okay.
I mean, they can wear a mask, and if they have a health issue, that would be one reason. We've also had some conversation about the clear mask. I know Dr. Meserly and I have talked about that. I haven't seen a lot of research on them. These are masks that have a clear plastic piece in them. And I know that some school districts were going to purchase some of those and try those. I don't know how uncomfortable they are to wear. They're masks, so it's new. It's going to be uncomfortable because it's going to be a new experience. But I do appreciate wanting the student to see the teacher's mouth, the instructor's mouth, and their facial expressions, if that works out for you. I also don't know the expense of those either. So I think that's another thing that you would want to look at.
Okay. Next question, I think, Robin, it'll be for you, is when will we hear back from FEMA? And is there a limit for reimbursement?
So FEMA is actively, through emergency management, is actively scheduling appointments with local school districts. I'm starting to hear that some of you have had an opportunity to meet. As you know, there's lots of you out there, so it will take them a little time to schedule those first meetings with each of you. And what was the second part of the question, Tony?
Is there a limit for reimbursement?
We have been informed by emergency management through our contractor that's been assigned to us that there is not a limit. You know, I will share with you, that's the first time I've ever heard that. I think they are speaking more in the terms that this is an open-ended emergency. For many FEMA emergencies, they have a beginning date and an end date. And since we don't have an end date yet, I think they're talking more about it not being limited in that way, as well as the dollar amount. But I think the Department of Education is also an applicant. So we are patiently waiting for our turn to talk to the FEMA representatives as well. And as soon as we do, we will share with you everything that we learn in our individual meeting as you continue to wait for your meeting as well.
Okay. The next question is, we didn't send surveys out since the ones KDE sent out asked for districts. We would like to get these results very soon. So I believe, as we stated earlier in the communications report, we just closed the classified survey yesterday, and we're working on gathering those results. We're working with KY Stats to put them in a format so that you can easily read those results, and we'll plan on getting those to you very soon. They also will be discussed with you at the next webcast, but we hope to get them to you before then, so that if you have any questions, we can talk to you about them then. Karen, did you want to add anything to that?
No, that's correct. KY Stats has all of that information right now. Any of you who have ever tried to put together a dashboard, it does take a little bit of time. So we're just waiting for that to be put together, and we're very grateful to KY Stats for prioritizing that for us.
And then, speaking of KY Stats, I also wanted to let you know that we did receive the Healthy at Schools document that has been translated back into 4 different languages from Jefferson County's Language Services Department today. And we're working on getting those put up in PDFs. Those will also be available on our COVID-19 website. And I will also be, as soon as I'm having issues at the hotel here with uploading very large documents. So if I can't get those out to you today, they will come out tomorrow to you. And then also the posters. I know a lot of you have been asking about those. So I really just want to give an additional shout out to KY Stats and also Jefferson County's Language Services for really helping us translate those posters and the Healthy at Schools document into those, a total of 5 languages, English plus 4. And then we'll take a couple more questions because we're looking right at 4 o'clock now. We're gonna, Kevin, did you have something you wanted to add?
Just a comment from a superintendent I just received about hearing impaired students and the fact, and I believe public health has already answered this previously, but want to confirm this, and I'm thank you for sending this. If a student's disability prohibits them from wearing a traditional mask, even if it's not a breathing issue, but obviously for hard of hearing students, they're going to need to see the mouth, or teachers will as well, in order to communicate that this superintendent indicated their local health department has approved the use of the clear face shields for those circumstances.
Yes, the question that I understood was the face shield a substitute for a mask, and the answer to that is no. But if you're dealing with a hard of hearing student, that would certainly make sense if that's the best way you can communicate with that student. And I would I would love for some of you to purchase some of those clear masks, because I just don't know anything about them, but I think they look very, very promising. They would certainly be a better protection for the students than the face shields would be, but you have to balance that.
Okay.
I want to make 2 quick points before we break today. One is about local health department approval, and I like what you just said it, Commissioner Brown. I didn't want to leave the impression with people that you have to get your plan together and you have to give it to your local health department and they have to approve it before you can do school. Our hope of getting the local health department involved with your school plan is so that you are all on the same page with that. But there's no formal approvals mechanism that a local health department has to do. We just would want to make sure that we're in step together as we move forward, so nobody has any surprises. The second one I wanted to bring up, and this is almost a question, it's from a meeting we had yesterday, and I'm checking with our contact tracers, but I think because of the whole issue of wanting your parents to feel like the school is safe, is trying to put together a couple of videos. One that says, if we are opening school, we're keeping everything safe. If a student becomes infected with COVID-19, we have a plan in place to isolate just those students at risk. A second video would be, guess what? A student has been diagnosed with COVID-19 at our school, and we have a plan in place to try to mitigate people saying, oh, like we talked earlier, oh, there's a positive child, I'm gonna take my child out of school. I think maybe if you think that would be helpful, we will try to either find something like that that's already been created, and if not, we will try to create something. And I'm blanking on the organization that did that video before, Commissioner, that was so good. So I think we will try to help pull something like that together, so it's something you can market before a COVID-19 case happens, and then afterwards you can market. We expected this. We have a plan in place. We don't have to send everybody home because of one case or a small cluster of cases.
And what Dr. White just explained was a result of a conversation and guidance and feedback we received yesterday from the Superintendent's Advisory Council. So I want to thank those members for that. Tony, I know we have kind of an unusually, we normally quit around 4, but we have been going a little later, but we do have the state board's getting ready to come back into open session, and there's several of us trying to do 2 or 3 different things. So we have about 5 more minutes. Tony, is that okay?
Well, yeah, that's fine. And I don't want anybody to think they're coming back anytime soon, because they are running a little bit behind, but we do have to switch the webcast over. So there's
there's some technical issues.
Yeah, there's some technical issues.
So,
but I do want to raise one, because this is a good question in regards to the 10% of testing, because there's superintendents in Northern Kentucky are saying that they don't really have any testing sites unless a doctor orders it and the person pays for it. And they have infrequent, Kroger drive-through testing in the area. So is there any plans for DPH or the health department to get some additional sites up in Northern Kentucky so that they can ensure that 10% of their teachers and staff are tested each week?
Well, you can go to the covid19.ky.gov, and the very first thing that pops up is a map of all the test sites. And you click on those, and it will give you the location and the phone number and the way that you can register to get that testing done. So I would stick with that as a quick way to find out about testing sites that are.
Oh, did we lose her? Or did you all lose me?
That's Dr. White's
I can
connection,
hear
I
you, Tony.
believe.
Okay. I wasn't sure, so. Okay.
Do we have additional questions coming in on soapbox, Tony, that we haven't covered?
Yes, we do. We have a couple more there, so I just thought I would tell you. So if a student or employee has come in contact with a positive case, must they quarantine for 14 days, even if they go get tested and the test is negative?
That, hear me now? I turned my video off.
Yep.
Did you hear the question, Dr. White? I can answer it.
Yes. So yes, even if you go and get a test and it's negative.
So the question is about contact tracing.
Okay, still not coming through.
Well, you're frozen,
So
but we can hear
you
you.
are exposed. Okay, that's fine. I don't change that much. So if you're exposed to someone that's COVID-19 positive, the reason for the 14 days of quarantine is because it may be 7 days or more before you start developing symptoms and have enough of the DNA in your system to trigger a positive test. So just because you get a test done, the PCR test, and it's negative does not mean that you have not been exposed and will not develop this illness down the road or even be an asymptomatic carrier. So that's why the 14 days of quarantine is instituted, because that's how long it takes for you to be free of infecting someone else. So no, that would not substitute for the 14-day quarantine.
Okay, and then so there's another comment on the soapbox. It says only the Bluegrass Urgent Care Center is a site for Northern Kentucky, and they require doctor's orders and payment, and that is through the KY COVID site. So I don't know if that's something that maybe you all can look into. I'm not entirely sure who decides which sites there are, but they're saying that it's a problem that they can't get tested without a doctor's notice up in Northern Kentucky.
And it, okay, I can't answer that because I wasn't aware that that was even an issue for the drive-through testing. I can't answer to the testing cost. My understanding is there should not be out-of-pocket charge to a patient. So if you go through and they file your insurance and someone balance bills you, then you can let me know. Everybody should know my email address by now. I'm smiling. You can't see that since I'm frozen. But then you need to let us at the Department for Public Health know, and we will follow up on that because that should not be happening.
And they said,
Emily, do you have any?
That's an executive order from the governor. That there is no one is to be charged to take a COVID. That's an actual executive order, so no one should be charged.
okay, and they added that they also, would like to consider going up to Cincinnati, but the drive-through sites in Cincinnati are not allowing Kentucky residents to test. So they're just out of options, is what they're saying. So maybe we can look into that for them and maybe try to get an answer for them for next week.
Yeah,
Sure.
and we'll also flag that too and discuss that with the Lieutenant Governor's office as well, just so they're aware of that potential, not only the access issue, but the potential cost issue.
Okay. All right. Just another question. This might be helpful. Has guidance been given on where to purchase masks for students that will fit them? Because most that we're finding are for adults. Do we have any?
You're muted.
I can answer
well,
that.
I know we found some for my granddaughter. Go ahead.
So I wanted to bring this up because I am going to work with our SNAP, EBT, and WIC departments we haven't passed anything yet, but we are going to find out if we can get that covered, masks covered under EBT benefits, so that families don't have a barrier in buying masks. But Walmart has child-size masks, as well as Target, and they're $2 each. So there's really good cloth reusable masks I've seen at both Target and Walmart. But what we could do is we could find sources, or districts can find sources and actually put links to that on their webpage. That would be something that would be helpful.
I think that would obviously be helpful for parents to have those links. And then Robin, Kenny may want to flag that issue for the co-op directors, and the co-op directors should be listening to this call because they're procuring, some of the co-ops are procuring on behalf of districts. And then Robin, to the extent the finance cabinet is able to has a price contract, make sure that there are child size masks on that price contract.
And I think you also, as a school superintendent, can ask your local schools to reach out to the community, because I say this with great affection. I'm one of those little old church ladies that if I knew our local elementary school needed children's masks, First United Methodist Church in Frankfort would have 150 of them by Saturday, because they would be on that and committed to it. All they want you to do is tell them what color you want it in, and they would be doing that. So there's an outpouring of that. I think you will find, and you know your communities better than obviously than I do. I know my local Frankfort community.
Okay.
And Tony, I have a question that came in to me on my text. The question about the comment that we've made several times, and the governor has made it as well, about a goal of testing 10% of school staff. That is a goal. The governor talked about that. I talked about it as districts shooting for encouraging their staff to have at least 10% of their staff to be tested every week as an encouragement and as an incentive. Public health friends, correct me if I'm wrong, that is not a mandate at this time, but it's something we want to encourage.
That's correct. It's not in any of our documents. Correct.
Okay. And Tony, I only have one more thing, and this may be, we probably need to save this for next week, but on the we've had in the media, we've had some World Health Organization reports about the airborne nature of the virus that was mentioned briefly. We've had an American Academy of Pediatrics a report has been issued, and I know our public health friends are aware of that. Probably take too long for them to discuss that, but they are aware of all of those things. Obviously, they're medical professionals and they read all of that. And so they're taking all of that into consideration when they're arriving at the guidance appropriate for Kentucky. So do you all want to comment any further on that or defer that to next week?
Well, we can assure you, as you said, we've looked at it. We've talked to Dr. Stack about it, Dr. Messerly and I've talked. And at this point, we're not, we don't feel led to change anything of the recommendations we've made this far.
Okay.
Okay.
And the final word, I think, will be from Robin Kinney to share an update on thermometers.
Thank you, Commissioner. While we were on the call today, I've received an update from the Department for Public Health that's been working so closely with us to get those no-touch thermometers distributed. So I just received this, but I wanted to let you know, since we're not going to be online together the rest of the week, we'll be sending out information directly to superintendents. I'll also try to, I know we have a finance officer update, I think, later this week too, so we'll share with them on the distribution information, where to go, when to pick them up, all that. It's come in, but it's not in a format that I can share right now. So we'll work hard to get that pushed out to you this week.
Oh, Robin, I was going to ask you, even though it's not COVID related, did you want to mention about the Senate bill funding on that? Just let them know what time that webcast is on Thursday.
Yes, if I could remember what time it is on Thursday. You should have read in the superintendent's Monday message that we are going to share with your finance officers on Thursday, and I'll look for the time. about the distribution of funds to support Senate Bill 1 security facility improvements. That's that $18.2 million that was appropriated by the General Assembly. We'll be sharing with your finance officers, and of course, superintendents are always welcome to attend that call as well, along with your facility directors, to share about how we will distribute that, appropriate, and the permissible uses for it. So that's on Thursday.
Great. All right.
All right. I want to thank everyone. I think we had at least at the height we had around 488 participants today. So thank you for your participation and your continued work. Apologize for the number of flagged questions. You all really threw us for a loop on a few of those, and you're keeping us alive and well over here. So we will have answers for you on the next webcast for those questions we were unable to answer. And if you have anything in the interim, feel free to email me directly or contact me, call or text. Hope you all have a great rest of the week. The State Board of Education should be coming back into open session. May or may not be any decisions newsworthy. They may just come in and adjourn, but I just want to make sure you know that may be happening in the next within the next hour or so. We're anticipating.
All right.
Have a great week. Thank you.